Well, good morning, and thank you again for attending. Today, I'm joined by Dr. Carol Zimbalatti, public health physician, to give an update on our local COVID-19 situation. Louise Gagne, Executive Director of Community Services, to provide an update on schools, and Shannon Mantha, Executive Director of Clinical Services and Chief Nursing Officer, will provide an update on the COVID-19 vaccine rollout. Before we proceed, I would like to take a moment to acknowledge that the health unit resides on land covered by the Robinson-Huron Treaty of 1850. This land is a traditional territory of the Anishinaabe people. This land is also part of the unceded territory of the Algonquin Nation. I would also like to acknowledge the Métis historical presence in the region. I encourage everyone to continue on your journey of learning as we work to contribute to the process of reconciliation. Much has changed in how we are dealing with COVID-19. Due to the overwhelming number of Omicron cases, the province changed their approach to PCR testing, and the health unit has changed our case and contact management approach accordingly. In following the provincial guidance, only individuals who test positive for COVID-19 and either work or reside in a high-risk setting will be followed up with by public health. To be transparent, we don't have the capacity to follow up with every person who tests positive for COVID-19. There is significant community spread, and due to changes in testing eligibility, the number of cases reported are an underestimate of the actual COVID-19 infections in our communities. We are still here to support the public. Although we may not know of or be able to follow up with each individual case of COVID-19, our website has great resources to help support you as you navigate your next steps after testing positive, experiencing symptoms, or being advised that you have been in contact with someone who has tested positive. For children in childcare and for elementary and secondary school students, Ontario's school screening tool provides excellent information regarding isolation or self-monitoring requirements for most situations. However, the new isolation and self-monitoring requirements can be confusing, but we ask everyone to do the best they can to follow them. And our call center is also open Monday to Friday, 8:45 a.m. to 4:30 p.m. to help answer your questions. The best tool we have to protect against severe illness is to be fully vaccinated against COVID-19 and receive your third dose when eligible. 2 doses of COVID-19 vaccine reduces the risk of hospitalizations by about 82% compared to no doses. And 3 doses further reduces the risk of transmission and severe illness. It is well known that there is a limited supply of Pfizer, and I've heard that people are waiting until Pfizer is available before they receive their 3rd dose. Moderna and Pfizer are both excellent choices and interchangeable. In fact, Moderna is recommended for those who are older, as it has robust and prolonged protection compared to Pfizer. We're at a point where the local COVID-19 situation largely rests on individuals to make the responsible decisions, such as receiving all vaccine doses for which you are eligible, limiting your contacts, and isolating appropriately when you have been exposed or have symptoms of COVID-19. So please don't wait and book your appointment today. So with that, I'll pass it over to Dr. Zimbalatti.
Thank you, Dr. Chirico, and good morning. Case numbers are no longer a good representation of the local COVID-19 situation, so I won't be reporting on those today. The more important numbers relate to the number of hospitalizations and ICU admissions locally, because the goal of the current public health measures are to decrease the incidence of severe disease. Moving forward, we will share information on hospitalizations and percent positivity during our press conferences. Percent positivity is the percentage of COVID-19 PCR tests that are performed that come back positive. In addition, due to the vast number of COVID-19 outbreaks, we are no longer disseminating a public service announcement for COVID-19 outbreaks unless there is a specific reason to inform the public in this way. We are now only able to manage outbreaks in highest risk settings, such as hospitals, long-term care and retirement homes, corrections facilities, and group homes. This is similar to every other health unit in Ontario. We don't have the capacity or the test results to be able to manage outbreaks in any other type of facility or environment. Outbreaks and case information will still be available on our COVID-19 status report dashboard on the website. The aforementioned changes in testing eligibility criteria have also triggered changes in the COVID-19 indicators we are reporting on our COVID-19 status report. We are trying to provide data to the public that provides the most meaningful representation of the local COVID-19 situation. Some notable changes are being made to the dashboard, including making hospitalization data more prominent, adding percent positivity for testing as a new key indicator, shifting the focus on cases from demographic and exposure data to severity of illness by showing hospital admissions and deaths that have occurred across the different time ranges, reporting the percentage of health unit residents age 5+ who are vaccinated. We had previously reported the percent vaccinated of residents aged 12+. These changes will be made live for this afternoon's dashboard update at 3 p.m. As the situation continues to change provincially, the dashboard will be continuously evaluated to ensure it accurately reflects the local COVID-19 situation. As of yesterday at 3 p.m., there were 2 individuals in hospital due to COVID-19. Our percent positivity is 14%, meaning that about 1 in every 7 people who receive a PCR test get a positive result. Since our last press conference, unfortunately, 1 individual has passed away due to COVID-19. According to the Ontario Science Advisory Table's dashboard, there are about 4,144 individuals in hospital in Ontario currently due to COVID-19. This is an increase of over 20% in the past week. Now back to you, Dr. Chirico.
Thank you, Dr. Zimbalatti, and I'll pass it over to Ms. Gagne to talk about the schools and COVID-19 update.
Thank you, Dr. Chirico. On Monday, students within our district moved back to in-person learning. We are very supportive of this direction by the province. Schools are not considered a high-risk setting, and many precautions have been put in place, such as enhanced masking, screening, rapid antigen testing, and HEPA filters. The vast majority of students who attend school are eligible to be vaccinated against COVID-19 to help prevent severe illness. No location will ever be 100% safe from transmission, and virtual learning has by no means kept students free of COVID-19 infection, as there are multiple ways that students are being exposed. We do expect that there will be cases of COVID-19 in the schools. However, school-aged children are at extremely low risk of severe illness from COVID-19 as compared to adults. And we know that school closures and virtual learning have had a negative impact on the mental health of students, as well as their social and academic growth. The impact will increase the longer students are out of school. Currently, the benefits of in-person learning outweigh the risk of transmission. If you are a parent who is nervous about having your child in school or childcare, we recommend that you do an individual risk assessment and decide what you think is best for your family. We will continue to support the school boards as they navigate through providing in-person learning throughout the pandemic. And with that, I'll pass it back to Dr. Chirico.
Thank you, Ms. Gagne. And now we'll have Ms. Mantha give us an update on the vaccine rollout.
Sure, thank you, Dr. Chirico. So as of yesterday afternoon, 3,510 5 to 11-year-olds in our district had received at least 1 dose of their COVID-19 vaccine. This represents approximately 41% of 5 to 11-year-olds within our health unit district. This is lower than the provincial rate of 50%. As students return to in-person learning, we are working to help reduce barriers to accessing the COVID-19 vaccine for school-aged children. One of our strategies is to offer COVID-19 clinics within schools. Tonight, we will be holding a vaccine clinic for 5 to 11-year-olds at Woodland Public School, which is in the Pinewood neighborhood at 1325 Cedar Grove Drive in North Bay. The clinic will be from 4 p.m. until 7 p.m. There are a few appointments still available, and we will also be accepting walk-ins tonight. Additionally, on the upcoming PD Day, next Friday, January the 28th, we will be hosting a 5 to 11-year-old vaccine clinic during the daytime at the Best Western Hotel and Conference Center in North Bay, and as well in Parry Sound at the Parry Sound Mall. Parents and guardians attending with a child can also receive their COVID-19 vaccine, first, second, or third dose at any of our 5 to 11-year-old clinics. You can book an appointment online at ontario.ca/book vaccine or by calling the Health Unit's call center. If you are still unsure about having your child vaccinated, there are several online resources available and videos that provide credible information regarding vaccinations in children, things that will answer your frequently asked questions, and offer advice on how to speak to your child and prepare them to get their vaccine. All of these resources are available on the Health Unit's website at myhealthunit.ca/kids COVID vaccine. Additionally, I'm happy to say that as of February 1st, all clinics in the district will accept walk-ins. Individuals can still schedule and book an appointment if that's what's most convenient for them, but we will also be accepting walk-ins. Thank you, and now it's back to you, Dr. Chirico.
Thank you, Ms. Mantha. So that ends our remarks, and we will take questions now. Try to answer as many as we can. You put them in the left of your screen, and please associate your name with them if possible, and I will pass it back to Ms. Wardell.
Thank you, Dr. Chirico. Our first question comes from Richard Coffin at mynorthbaynow.com. What is the Health Unit's reaction to expectations the Premier will announce an easing of some restrictions?
Well, thank you for that question, Richard. First of all, we have not received an official announcement of what those recommendations will be in loosening the restrictions. However, in general, what I can say is that I'm not in favor of loosening restrictions at this time. I think we need to be very mindful of our past experience and move slowly and cautiously, especially with the recent return to school. I think that loosening restrictions increases the risk of increasing contacts and potential for community spread to be larger. Yes, it is a matter of balancing risks. However, our healthcare system is still under pressure. And this week in Ontario, we've seen a hospital occupancy increase by 20%, ICU occupancy by 84 cases, and there's over 800 patients that are being ventilated for COVID-related and non-COVID-related issues. So when we have hospitalizations remaining high and our capacity is limited, there can be negative impacts to those that really are waiting for surgeries and receive treatments. Locally, we're seeing increasing outbreaks in congregate settings. Our healthcare workers are exhausted. They've been pushed to the limit, and they've been doing this for a long time. Absenteeism rates have increased in many sectors in among healthcare workers. So it's very concerning. And hospital beds are at a premium. So, and the other important thing is, tragically, we've seen an increase in a number of cases of people dying in our local area. So overall, I think that we need to move very slowly, very cautiously. And when we do so, I think that it's important that we monitor it very closely. And nobody wants to have to revert back from loosened restrictions to what we've seen happen in the past. It's too disruptive. So my advice is moving very slowly and cautiously.
Thank you. Our next question is from PJ Wilson. This is for Dr. Zimbalatti. Is the local health unit testing wastewater for COVID? And what is the testing showing? Are we finally on the way down as other communities seem to be indicating?
Thank you, PJ, for that question. The health unit itself is not testing wastewater. However, we do get results of wastewater testing from North Bay treatment. So unfortunately, with our local numbers, there's quite a bit of variability in the wastewater data, so it is difficult to interpret and draw any conclusions from the data that we have available. I think wastewater data does show promise in terms of informing the provincial direction or the direction in terms of in larger municipalities that are able to gather data regarding larger numbers of individuals and have more sampling points. But for now, the wastewater data that we are receiving is just for informational purposes only.
Thank you. Our next question is for Louise. This comes from Sarah Bissonnette at Parry Sound North Star. In discussions with school boards, do you have an idea of how many students didn't return to school this week, possibly due to the parents' concerns around Omicron?
Thanks, Sarah, for that question. I'm not aware that information hasn't been shared with us as of yet, and that would be a good question to direct to the school boards.
Thank you. This next question is for Shannon. Are you concerned by the relatively low level of vaccinations among children? As of Wednesday, the rate is just over 41%.
Yes, yeah, thanks for that. And in my preamble, I did speak a little bit to this because we are concerned about the vaccination coverage rate for this age group. So we're sitting at approximately 41% of 5 to 11-year-olds who have received a first dose. We would like to see this number much higher within this age group. Getting this age group vaccinated means ensuring children can continue with their routines of daily life. They don't miss out on important things like recreational activities and in-person learning. So we are continuing with appointments and adding walk-in capacity to our clinics, hoping that this increases access and opportunity for individuals. Additionally, in mid-February, we will be offering the 5 to 11-year-old vaccine at all our vaccine clinics. So if you attend to get your third dose, you could also bring a child within that age group and get a pediatric vaccine. So that is coming in mid-February to our clinics, which we hope increases opportunity. And as mentioned earlier, we're working on vaccine clinics in school locations, in smaller rural areas where people may have a more difficult time accessing our regular vaccine clinics. And we're also working with primary care partners as another potential channel for vaccination for this age group. So we are concerned, and we're actively looking at and working on and implementing different strategies.
Thank you. Our next question is for Dr. Zimbalatti. It comes from Richard Coffin from mynorthbaynow.com. The province has reported on COVID-19 cases in hospital because of the virus and those who are in hospital with another ailment, for example, a broken ankle, and happen to test positive for COVID-19. Does the health unit plan to do the same?
Thank you, Richard, for that question. We do communicate regularly with our hospitals on the hospitalization data that we have locally, as well as getting hospitalization data from the provincial database. So in terms of the cases that we are reporting that are in hospital locally, we are only reporting the ones who are admitted due to COVID rather than with COVID.
Thank you. That concludes the questions that we have for today. So thank you all for joining us, and we will see you again on February 3rd. Take care.